Parents want their kids to grow up healthy and happy, but a rise in mental health issues affecting Australian children as young as 8 is alarming authorities. Now there's a new program designed to help vulnerable children early.
Boys, be ready for Yahtzee?
Yep.
The Harrington Brothers are playing a game of chance. But when it comes to their mental health, they know they can't afford to roll the dice.
Oh, I got him.
All 3 boys have anxiety and depression.
It's almost like a monster that lives within your head. It's very scary, whatever monster it is. It's very, very terrifying.
Reese was first diagnosed when he was just 9 years old.
By the time I hit 15, 16, it all just crumbled and I was just lost. It was dark, scary, and it was way too much of a climb to get out quickly.
Jackson is 17. He says watching his brother battle his demons helped prepare him for his own journey.
He showed me and Cooper so many ways in how to fight it, and we struggle a fair bit, but with Reese's support and what we've learnt from him, it makes it so much easier.
At 13 years old, Cooper has been diagnosed with psychogenic non-epileptic seizures, a condition that wreaks havoc with his anxiety.
Mine come out in seizures, which have made things pretty tough, school-wise and all that, and I don't think that's been helpful.
To be so young and having such big emotions, how would you describe it?
It's a mindset that you shouldn't be feeling this way when you're this young, but it can develop in anyone, any age, and so you can't be thinking you got to be older just to have that help.
While it breaks his heart, their father Mark is so proud of the fight his boys are putting up to beat the black dog.
All 3 of them, yeah, it's definitely a challenge. Sometimes it hurts, sometimes you question everything about yourself, about just everything around it. But yeah, it can be difficult.
As their dad, what advice do you give your boys?
Try and look for something small, something to hold on to, something to look forward to.
This is the adolescent ward. We call it the Loft.
There are 23 youngsters holding on here at the Hills Clinic on any given day.
Sometimes in the early stage.
Dr Tanveer Ahmed is one of the psychiatrists and says for every patient he admits, aged between 16 and 23, many more are being turned away because they're too young.
It's a real crisis, Dimity. There's more and more teens, adolescents, and even kids young as 8, 9, 10 seeking urgent help. They're self-harming, they can't go to school. Many of them are screaming both outside and on the inside, and they can't always access what's needed.
Here, it couldn't feel further from a hospital setting. Designed like a New York loft apartment, it's edgy and it's relaxed, and it's saved hundreds of young lives.
Clearly, at a national level, there's a big gap in these types of facilities.
It's called the missing middle. Treatment catering for young people who aren't in crisis, but need more attention than their weekly visit to a mental health clinician.
Is there anything like this in the public system?
No, it would be very tough to get. The public system is geared for crisis. So what they can do, in mental health at least usually, is grab you in a crisis and keep you safe for a day or night. That's why it can be so frustrating for parents, because that sometimes is a crisis, but then a few weeks later there's another crisis, right? And that's exactly the group we're talking about, the missing middle, because that group needs intensive, kind of consistent contact, and it's very labour intensive, and they're the services that we need a lot more of.
Doctor, I can't tell you how many parents have contacted us saying, I don't need crisis, but I need more than once a week. So why are there not more of these facilities?
In terms of helping troubled young people build social skills, acquire skills, and participate in the future in work, friendships, that kind of stuff. I don't think you can invest enough in that.
Reese has been admitted to the private mental health facility 4 times.
And how does all of this sort of stuff help when you're here?
The common rooms are very good because you can chat with people who are also in hospital at the same time, so they're also going through similar things.
CEO Jackie Ma says in 12 months the number of beds here has doubled and they're always full.
What's the youngest person who you've ever had knock on your door?
9. And it's tragic. It's really tragic. You wouldn't believe a 9-year-old would be experiencing that sort of mental health. They should be out there kicking a ball and loving life.
From equine therapy to Tai Chi in the garden, it's not all about talking through the pain.
How do those sort of techniques help with a young person's mental health?
It's actually being able to break down that barrier. And actually, if you have them doing that, they're not thinking, you're interviewing me, you think there's something really wrong with me. It's just allowing them just to express themselves openly while distracting from the main concern.
Mark knows more than anyone that for every sick child, there is a lost parent or carer.
Seek help for yourself. So ask for what's the right thing to do, what's the right thing to say. You don't get told. You don't know it. We're all learning as parents.
The Hills Clinic has just launched a help program for parents.
It's a 2-day course. They'll come in and we'll be able to teach them skills to support their younger ones.
For the Harrington boys, it's about learning to cope now and into the future. And at just 13, Cooper has some advice far beyond his years.
Just to know that you're not alone through that, I think that's definitely something that you got to come to grips with, because otherwise you just feel stuck, you feel all alone in the world, and that's not a good feeling. Once you're older, you'll be thanking yourself for making that journey, and I think, Reese has definitely become better for it, Jackson's become better for it, and hopefully I'll become better for it.
Aren't they remarkable? It is such critical work, and if you'd like to find out more, the details are on our website. And if you or someone close to you needs help, there is support available. Contact Kids Helpline at any time, day or night. The number's on your screen right now. 1800 551 800. That's 1800 551 800.